Welcome everyone to another edition of Cosmetic Corner. This ASJ segment is designed to critically analyze an article in each issue of ASJ. Our objective is to utilize experts in the field to help us evaluate and really extract the key practice changers from these peer-reviewed works. Today I have kind of a special edition for you. I am calling you from Hyderabad, India, where I'm currently on a medical mission trip, and Dr. Hunstad, who is 12 hours behind me, is joining me from North Carolina. We're very fortunate to have Dr. Hunstad today as our expert discussant. Among many things, Dr. Hunstad is a very well-published author and a very accomplished plastic surgeon in North Carolina. He runs a large and vibrant aesthetic surgery practice and has his own ASAPS accredited fellowship. Dr. Hunstad, thank you for joining us.
Oh, it's my pleasure to be here, Chris. Thank you so much.
So we're here tonight and this morning in two parts of the world to discuss a very thought-provoking article out of California titled Burnout in Plastic Surgeons, Implications and Interventions. I commend the authors for tackling this topic. This is a special topic manuscript critically analyzing the current literature on physician burnout, particularly as it relates to plastic surgeons. It's complemented by an excellent commentary by Dr. Noon. I think this can be a tough topic for physicians to talk about. By and large, I suspect it is safe to say that plastic surgeons are type A personalities, very driven, and oftentimes perfectionists at baseline. So the idea of burnout may be viewed as a weakness to some. However, when you read the article, it puts things into perspective and highlights some of the predisposing factors that may make surgeons with a very sound mind and body still possibly struggle with elements of burnout. So, Dr. Hunstad, we're going to dive right in and talk about some of the components of the article. The article postulates that there's a 45% burnout rate of plastic surgeons. And although this falls on the low end of the spectrum compared to ER doctors and critical care physicians, for example, I find this to be a pretty staggering statistic, that almost half of the population of plastic surgeons in this survey reported some element of burnout. What's even more astonishing is that the suicide rate is 40% higher in male physicians than the general population, and 130% higher in female physicians than the general population. So, Dr. Hunstad, what are some of your initial thoughts given these statistics, and have you ever known a colleague who may have struggled with some element, even if it's minor, of burnout?
So those statistics are indeed very worrisome and troubling to me. I mean, again, as I've said, I believe it's an honor to be a plastic surgeon. And when I hear those burnout rates, I'm really, my heart goes out to those individuals. I mean, yeah. I had a colleague of mine who I went through general surgery training with, and then I went on to do plastic surgery, and he was in private practice in general surgery, and he suffered severe burnout and actually suicide, believe it or not, at the end of that in his situation. And I was incredibly sad and disappointed for my colleague, my friend, his family. And I mean, things like that can happen, but it's so depressing and difficult. But I think if we look at plastic surgery for what it is, that vast, wonderful field that it represents, and I think if we stay current, involve others that are in our specialty, go to meetings, interact with friends, colleagues, nationally, internationally, I think we can rekindle that fire that brought us into plastic surgery initially, and hopefully reduce that degree of burnout. I understand about patient dissatisfaction. We have those groups of patients, if they have a result that's less than ideal, we see that, they see that, that's okay. If they have a great result, they see that, we see that, that's okay. But if we believe they have a really good result and they don't see it that way, that's where the trouble is. That's where the disconnect is. That's where the challenge is. And those are the things that can be incredibly frustrating. Fortunately, we don't see those that often, but when they occur, we can see 99 people in a day, and one person that's dissatisfied, that's the person we take home with us, that's the person we're thinking about, and that's the person who remains on our mind.
Yeah, excellent answer. Thank you very much, sir. You know, what advice can you give physicians, Dr. Hunstad, on how to, maintain a good work-life balance in an effort to maybe combat burnout if it does sneak up on us at some point?
Yes, sir. It cut off just for a second. I'll share with you the term you used, balance, is the most difficult, challenging term that I've ever used in my private practice. The balance between your practice, and our home, our wife, our kids, our family, our church, all of these things are other involvements. That is really a challenge. I can tell you certainly that I have not created a good balance. I've tried, and thank God I've got a great wife that helped our kids be very successful. But as far as burnout, we need other avenues of escape outside of our practice. We need to have other interests, hobbies that can maintain our attention. Yet on the other hand, in plastic surgery, I think one of the things that's helped me and my colleagues reduce our element of burnout is to help our practices evolve over time. For example, when I first started my practice 30 years ago, I did primarily traumatic hand. Now I do primarily facial aesthetic surgery, and it's evolved through breast and body and now face. And I think if we see a successful climb up that ladder by delivering good results and creating good patient-physician interactions and relationships, that helps as well. So yeah. I think that we have to be very careful. We can't lose sight of delivering outstanding results and having a compassionate, caring environment for our patients. And you can say that marketing is incredibly important today, which it is, and other things, but still those strong patient-physician relationships are still paramount.
Absolutely. The data from the paper postulates that burnout is inevitable due to the current organization of medical education training. And they suggest, researchers that look into this suggest that our education is very training focused on technical skills rather than interpersonal skills, and maybe a lack of training in team organization and leadership. In residency, sometimes we're taught that really every patient encounter has the potential for a misdiagnosis or a pending problem, and that's important for training, but they believe that this might lead to some of the workaholic tendencies and the lack of a physician attending to their own needs. And they point out some interesting programs at Oregon, UC Irvine, Stanford, other places where they're trying to combat these phenomena early on in our training. But I think this is particularly interesting in the aesthetic surgery world. The data shows that aesthetic surgery and microsurgery, as a matter of fact, were the two subspecialties in plastic surgery most prone to burnout, which I thought was interesting. And they claim the reason for aesthetic surgeon burnout is, increased market competition from non-plastic surgeon entities. As we know, there's lots of people who aren't board-certified plastic surgeons who are advertising and practicing as cosmetic surgeons, right? The changing economic climate, and of course, as you said, the ever-challenging what is a good result in the patient's eyes versus the surgeon eyes. So I guess my closing question for you, how do we as aesthetic surgeons mitigate this increased market competition from non-plastic surgeons, the fluctuating and economic climate, and again, with patients coming in on our websites, oftentimes we show all of our best results. And in the commentary, Dr. Noon said sometimes that might set us up for a problem with the consultation if we show just our best and not our average results, as it may alter what the patient's real expectation is of the surgical outcome. So what are your thoughts on these things?
Those are all really good points, Chris, and I think Barry Noon was really astute in saying that. But if we can present to our patients, a spectrum of results, which we try to do, from the very, very best to, moderate and intermediate, I think that gives them a better idea. And if we use tools during our consultation that share with patients average, good, exceptional results and explain to them they may have any of these three in the spectrum, I think that helps mitigate that over expectation, that over demanding patient. But it's still a challenge. Even in the very best of hands, even in the very best of our leaders, we still fail. I mean, I've heard it, you've heard it, we've all heard it, that I don't regret operating on those patients that I turn away, but I certainly have regretted operating on a number that we've accepted. And I mean, that is just the way it is. Yeah. But again, as far as burnout's concerned, I still believe it's a privilege to be a plastic surgeon. And I think if we keep our eye on the ball and are attending aesthetic meetings, enhancing our training, bringing in colleagues and others like ancillary services and other things that grow and build our practice, I think that helps us, because as we grow, I mean, I think we remain engaged and excited about what we do, and I think it can help reduce burnout. And it's interesting that I believe that in the clinical area, if we're hospital-based physicians and other things where we're not as in control as in a private practice, I think there are going to be much greater challenges in that, and much more frustration and I believe burnout in that arena. Whereas in our own aesthetic practice, I believe the risk of that will be reduced. And I know myself and my colleagues that I speak with and spend time with worldwide, we still enjoy and love what we do. And I hope that those that attend meetings can grow from that and experience that. And hopefully incidents of burnout will be minimized because of that.
Excellent. Dr. Hunstad, thank you so much for being an expert discussant. You were excellent. We really enjoyed visiting with you today. Your insight is very important, and hopefully we can continue to grow in the specialty of plastic surgery and avoid the burnout rates. And for those who are listening on ASJ Cosmetic Corner, thanks for joining us, and we'll see you next month. Bye now.
Thank you, Chris.